Welcome to On the Beat, everyone. I'm Troy Thompson. Joining me today is Dr. Huxford from the Huxford Clinic Pulmonary Sleep Medicine Centre. How are you, my friend?
Very good, Troy. It's always a pleasure.
Likewise. Okay, today we're going to talk a little bit about lung cancer screening, I should say, and the processes that one would need to go through in doing that. But before we get into that, at what point does one think that they may need to have lung screening to begin with? Are there any signs that something could be wrong?
No, usually it's done on people who aren't having any issues. And everybody's familiar with if you're a woman, you're supposed to get a mammogram. There's certain rules on that, and all of us are supposed to get colonoscopies, and men are supposed to have prostate exams. So we're all aware of cancer screening. Lung cancer screening's been around just for not very long. And the specific requirements is that you're supposed to really not have any symptoms, but that you fall within a certain age and you've been either a past or present smoker.
Right. So do you know what that age is for people at home so they can be aware?
Yes. If you're between the ages of 55 and 80, that's the first criteria. And the second one is based on what's called a pack year smoking history. And so that's if you've smoked 30 pack years or more. And how you figure that out is if you've smoked 2 packs a day for 15 years, that would equal 30 pack years. 1 pack a day for 30 years would be that, or a half a pack a day for 60 years, you would still come out to the 30 pack year history. Wow. So if it's that or more, and you're between the ages of 55 and 80, you should ask your doctor about that.
That's interesting. Always new information, Dr. Huxford. Thank you. Well, let's get on to how the screening is actually done, can we?
Yeah, it's very simple. It doesn't hurt. It's just a CAT scan. And oftentimes a lot of these people will have already had a CT scan or a CAT scan of their chest for various reasons. And this one is a low dose. So the radiation that you get is lower than a normal CAT scan. And so it's a 30-second test.
Okay, well, we've already talked about who's eligible for lung screening in our opening. Let's talk a little bit about, is this covered by health insurance if you have health insurance?
Yes, if you fall within those requirements.
Right, that's perfect.
If you're,
I always like to ask you that question because it may put someone off not going to have it done if they fall into that criteria. So what's the procedure if something is found during the screening? God forbid it's not, but it does happen.
Right. So now you could find the thing is you're trying to find early stage cancers, right, at a time where you could do something about it, maybe surgery, maybe whatever. Now, CAT scans will show other abnormalities. So sometimes we get what's called a false positive. Maybe it sees something, and then that person may be sent to me or another lung doctor and said, hey, we did a lung cancer screening. It showed this little spot. And so then we can address it. Not everything that's found has to be, will be a lung cancer. There are a lot of benign findings that we could see.
Right. And it could be infections. It could be all sorts of things, right?
Correct.
And when you get the screening, what's the turnaround time before one would get results? I know I would be on the edge of my seat every day waiting.
We usually get this day and time, we usually have a report back within a day.
Really? That fast?
Yes.
That's amazing.
And then I'll review the images with the person in the office if I ordered it or if they're referred to me.
All right. Very quickly, Dr. Huxford, do you need a slip from your normal GP to come and see the specialist?
Certain insurance require it, but a general practitioner is able to order that without seeing me.
Well, that's wonderful. Dr. Huxford, thank you so much. Again, always great information. We appreciate you.
Thank you, Troy.
If you want to find out more information about Dr. Huxford, there it all is up on the screen. We'll be back after this short break.